Hi, my name is Pauline Isabella Centeno from BSN 2A, and today I will demonstrating the mouth, neck, and thorax assessment. So, the materials needed for this one is the gloves, pen light, stethoscope, tongue depressor, tape measure, and notepad and pen. So for assessing the client, we need to identify the client and ask the name of the client. So, what is your name, sir? Okay, thank you, sir. This is to avoid medical errors and to confirm if the procedure is appropriate to the client. So, next one is we will now explain and discuss how the patient cooperate to us. So, today, sir, I will assessing your mouth, neck, and thorax. So, all you need to do is to follow my instruction. Is that okay, sir?
Yes.
Okay po, thank you po. So, in explaining the procedure to the client, it will lessen the anxiety and gain cooperation of the patient. It is also able us to assess the body of the patient easily. So for planning, we need to perform hand hygiene to avoid transmission of microorganisms that causes diseases and illnesses. So next one, we need to provide privacy. So we can provide privacy by closing the doors, curtains, and keep the patient covered with blanket if the patient is in bed, and we provide respect. It is to enhance autonomy, prevent economic harm, embarrassment, and discrimination. So this also avoid distractions from external noises or surroundings. So next one is, before the implementation, we must put our gloves We will put our gloves before assessing the mouth of the patient. So after putting our gloves, we will now inspect for symmetry of contour, color, and texture of the lips and buccal mucosa of the patient. So we will ask the client to open your mouth using our tongue depressor. So as we observe, the lips and buccal mucosa is pink in color, soft, moist, soft and smooth, and there is no discoloration like pallor and cyanosis. So I also don't see any blisters, swelling, and after that we can ask the client to purse his lips. So, sir, can you purse your lips like this one? So, thank you, sir. So, as we observe, the client have the ability to purse his lips. So, it is normal. So, next one, we will now inspect and palpate the inner lips and buccal mucosa for color, moisture, texture, and the presence of lesion. Open your mouth, sir. So palpate the inner lips. So sorry. So we will now palpate the buccal mucosa. So using our pen light, we can assess the color of it. So it is normal. So as we observe, the color is pink, which is normal, and the buhol mucosa is moist, smooth and soft, and there is no evidence of dryness and mucosal cysts. So next one is we need to assess the teeth of the client. So we will inspect for the color, number and conditions of the teeth of the client. So the client, as we observe, the client has no missing teeth. It has no discoloration that indicates tooth decay, and the tooth of the client is shiny and white. So if the client has a missing tooth, we can ask the client how it become missing and identify what kind of tooth is missing to the client. So next one is we need to inspect dentures if present. We can ask the client to remove the dentures, especially for the clients who is old. And after that, we will inspect the conditions and note for open areas of the dentures. The normal findings for this one, if the client has smooth and intact dentures and not irritated. So since our client is young and don't have any dentures, we can consider it normal. So next one, we will now assess the gums of the patient. So for the gums, we will inspect for the color and condition. So using our tongue depressor, we will assess the gums. So the patient has pink gums, it is moist, and there is no bleeding or swelling of gums. There is no redness that indicates inflammation. So we can consider it normal. So next one, we need to assess the tongue or the floor of the mouth of the patient. So we will inspect and palpate surface of the tongue for the position, color, and texture. So the tongue. So as we observe, the client is in the center, has a pink color, it is moist also, and slightly rough. So there is no ulcerations, and there is no discoloration in the tongue. So there is no nodes also present, and it is not dry. So also there is a thin whitish coating in this area, so it is normal. So next one is we need to inspect tongue movement of the patient. So we can ask the patient to move his tongue. So sir, can you move your tongue? So up, down. So on the left and right. Okay, thank you sir. So as we observe, the patient can move his tongue clearly, and there is no signs of tenderness of the tongue. So we can consider it normal. So next one is we need to inspect the base of the tongue, the mouth floor, and frenulum. So in this one, we can ask the client to move his tongue upward. So, sir, can you move your tongue upward? Okay, sir. Thank you. So as we observe, the client has smooth tongue base and prominent veins, and there is no also swelling and discoloration. discoloration at the base of the tongue. So the frenulum is also intact as we observe. So the findings is normal. So next one is we need to palpate any nodules, lumps, or excoriated areas. So we will use gauze to grasp the tongue. So using this one, we will instruct our patient. So, sir, could you please open your mouth? So I will be grasping or pulling your tongue. So to assess your mouth. Is that okay, sir? So as we observe, the client has normal and there is no swelling or presence of nodules, and it is normal. So thank you, sir. So next one is we need to palpate the uvula of the patient. So we need to assess the palate area and the uvula of the patient. So we will inspect and palpate for the color, shape, texture, and presence of bony prominences. So using this one, we will observe the color of the palate. So as I observe, the patient has a pink palate. The patient has smooth and soft palate. There is no evidence of discoloration. There is no abnormal bone growth in the palate. And there is no lesions, synapses, or cord. So we can consider it normal. So next one is we need to inspect uvula for position and mobility. So while examining the palates, so we will now ask the client to open his mouth. So open your mouth widely, sir. So thank you. So using our penknife, we will observe the uvula. So like this one. And so as we can see, it is in the light pink color, positioned in the center of the palate. There is no signs of immobility of the uvula, and there is no indicates of damage in the 5th and 10th cranial nerve. So after that, we will now assess the oropharynx and tonsils. So we will inspect and palpate the oropharynx for color, shape, and texture, and presence of bony prominences. So ask the client also to open his mouth. So using our penknife, we will now observe the oropharynx. So as we can see, the patient has smooth and pinkish color of oropharynx. There is no presence of lesions and redness, and we can consider it normal. So next one is we need to inspect size of tonsils, its color, size, and presence of discharge. So as we observe, the patient has normal tonsils. The structure is normal because it has a light pink color, and there is no also discharge observed. There is no ulcerations, and it is not inflamed or swollen. So if I grade the client tonsil, so I will grade it 1 since the tonsils of the client is behind the tonsillar pillar, which is normal. So the next procedure is we need to elicit gog reflex. So for gog reflex, we will touch the posterior wall of pharyngeal wall each side. So we can use the tongue depressor to depress it. So as we do this, you must remember that the patient must have bilateral response to consider it normal. So, sir, I will touch your posterior wall. So, as we can see, the patient has bilateral response. So, we will now proceed for the next assessment, which is the neck. So, for neck, we need to assess the neck muscle. So, we will inspect for the sternocleidomastoid muscle and trapezius muscles of the neck for abnormal swelling and masses. So, the patient, as we observe, the patient has equal size of the neck. So the neck is also centered and there is no evidence of swelling, injury, masses, or goiter. So it is normal. So next one, we need to observe the head movement of the client. To do this, we need to ask the client to move his head, move to chin, to the chest, move the head back upward, move the head on the side, as the ear touch the shoulder, like this one. So turn the head of the client to the left and to the right, sir. So as we observe, the client has coordinated movements and there is no signs of pain and discomfort while doing the face movement, and there is no evidence of involuntary movements. So there is no also observed muscle tremors and spasm with the client, so we can consider the findings as a normal. So the next thing is we need to assess the muscle strength. So we will now ask the client to turn his head to the one side while we were holding his head. Okay, sir, so please move your head to the left, to the right. Thank you. So next one is we need to ask the client to shrug his shoulder. So we will now put our hands to his shoulder and ask the client to move his shoulder up and down. So, sir, can you shrug your shoulder up and down like this one? Okay. So, as you observe, the client has equal strength response in moving his shoulder, so we can consider it normal. So, next one is we need to assess the lymph nodes of the client. So, we will now locate, palpate, and identify the lymph nodes for its tenderness and enlargement. So we will now remove the gloves to have better palpation. So we need to palpate the lymph nodes preocular, right in front of the ears. We need to palpate it in circular movement. So palpate the post-auricular at the back of the ear, and then to the occipital lymph nodes, the submandibular, the submental. So we will go to superficial anterior cervical, down to the deep cervical, palpate the posterior cervical. So right above the clavicle of the client, we will go down to the supraclavicular and infraclavicular lymph nodes below the clavicular of the client. So as we palpate, we must not feel any lymph nodes, because if we feel the lymph nodes of the patient, it is considered abnormal, because it has inflammation and enlargement, which is not normal. So after that, we will now after that we will now proceed for assessment of trachea. So we will now assess for placement of trachea. So as we palpate, it must be at the center of the neck. There is no mass thyroid enlargement, and there is no palpable lymph nodes. And there is spaces are equal to both sides. So it is equal. So it is normal. So we need to assess the thyroid gland of the patient. So we will now inspect for symmetry and masses. So in this procedure, we will ask the client to move the head of the client like this one. So as we can see, there is no visible masses and inflammation to the other side, sir. So it is normal. So there is no evidence of goiter and thyroid enlargement. So it is normal. So next one is we will now palpate for smoothness and areas for enlargement, masses, and nodules. So on this one, so we will go at the back of the client, and we will now start palpating. So as we palpate, the normal findings is there must no enlargement of thyroid as we palpate around it, and there is no evidence of nodules. There is no tenderness when we touch the thyroid gland. So if the enlargement of the gland is suspected, auscultate over the thyroid area for root soft brushing sound created by turbulence of blood flow. So we will now ask the client to hold his breath. So, sir, can you hold your breath? So as I place the stethoscope and release it, when I say breathe away, okay, sir? So we will now place the diaphragm of our stethoscope. So to the thyroid gland. So okay, sir. Breathe, deep breath. Inhale. Exhale. So on the other side. Inhale. Exhale. So thank you, sir. So as we observe, there is an absence of root upon auscultation of the thyroid gland. So next procedure is we need to assess the thorax. We need to assess the posterior thorax. So inspect for the shape, symmetry, and compare the diameter of antero-posterior thorax to transverse diameter. So in this procedure, we need to use our tape measure. So we will ask the client to sit straight. So we will now inspect the transverse and compare it to antero and posterior. So in getting the transverse, so I get 34 in diameter, and the antero posterior is 12, so which is normal. So the normal ratio must be 1:2. So next one is we need to inspect the spinal alignment of the patient. So we will now ask the client to stand up. Sir, can you stand up? So we will now observe cervical, thoracic, and lumbar. So as we observe, so the patient has a normal spinal alignment. Thank you, sir. So after that, we need to ask the client to bend forward. So bend forward, sir. So thank you, sir. So as we observe, the spine from behind is normal. So, and there is no evidence of scoliosis, lordosis, and other abnormal spinal curvatures. So it is normal. So next one is we need to palpate the temperature, tenderness, and masses. So we will use our palmar to do this. So as we palpate, sir. So as a palpation, the skin is intact. So there is a uniform temperature. There is no signs of tenderness or masses. There is no also lesions present, depressions and bulges at the back of the client. And there is no areas of hypothermia that I palpate. So we can consider it normal. So next one is we need to assess the respiratory insertion. We will now place our hand in the lower thorax with our thumb adjacent to the spine. This is spine, so adjacent. So like this one. So we will ask the client to breathe deeply. So sir, inhale, exhale, inhale, exhale. Okay. So as we observe, there is a movement between the thumb and it is separated between 3 to 5 millimeters. So sir, can you sit down? Yeah. So next is we need to palpate for vocal primitus. So we need to place our palm near the apex of the lungs here. But before doing this one, we must warm our hand first. So we will not shock the patient. So we will need to ask the client to repeat the words we will say. So, sir, can you repeat after me, sir? Can you say 1, 2, 3? Okay, sir. Say 1, 2, 3. So again, sir. 1, 2, 3. Okay. Next one, sir.
1, 2, 3.
So again, sir.
1, 2, 3.
So again, sir.
1, 2, 3.
Okay, sir. Again.
1, 2, 3.
So again.
1, 2, 3.
So okay, sir. Thank you. So after moving our hands from apex to the base of the lungs, so we observe the vibration of the sound created by the patient. So it is more heard in the apex of part of the lungs, and there is an equal sound in both lungs. So the abnormal findings for this one is the decrease of or absence of remitus. So it is associated in pneumothorax, and when we observe an increase in vocal remitus, so it indicates pneumonia. So next procedure is we need to percuss the posterior thorax. So we will ask the client to bend the head and fold the arm across the chest to expose the scapula cell. Yeah. So after that, so we will now percuss the intercostal spaces about 5 centimeters interval in a systemic sequence. So using our fingers, we will now percuss it. So next one. So down. So on the right side. So down. Okay. So next one. Okay. So down. So downward again. Over here. So downward. Other side. So next one. So other side. The other side. So next one. The other side. So downward. So last one. So upon percussion, the posterior thorax of our patient, so we observe there is a high percussion sound and then the scapula. So the lowest resonant sound is so in the part of the diaphragm area. So next one, we will now auscultate the posterior thorax. So using our stethoscope, we will now auscultate the breathing sound using the zigzag pattern. So while doing that, we will now ask the patient to deep breath. So open your stethoscope. So, sir, can you take a deep breath? Inhale and exhale. The other side. Inhale and exhale. So down. Inhale and exhale. Okay. The other side. Inhale and exhale. Okay. So down. Inhale and exhale. So to the other side. Inhale and exhale. So downward. So inhale and exhale. Okay, sir. So the other side. Inhale and exhale. So inhale and exhale. So next one, inhale and exhale. So downward, inhale and exhale. So to the other side, inhale and exhale. So downward, inhale and exhale. So this one, the other side, inhale and exhale. Okay. So the upper part, inhale and exhale. So the other side, inhale and exhale. So downward, inhale and exhale. Okay. So the other side, inhale and exhale. So downward again, inhale and exhale. So last one, inhale and exhale. So thank you, sir. So as we auscultate the posterior thorax of the patient, so I observe normal breath sound in the client, so there is no crackles or wheezing sound of the lungs, so it is normal. So we will now assess the interior thorax. So, sir. So we will now inspect the breathing patterns and costal angle. So formed by intersection of the costal margins in the angle at which the ribs here enter the spine here. So using our watch, we will now count the respiratory pattern of the patient for the whole 1 minute. So using our watch, we will now observe the rise and falling action of the shoulder of the patient. So let's start. So as we count, the patient have 15 breathing pattern per minute, so it is in the normal range. So there is an irregular breathing pattern observed to the client. So the costal angle is normal, and then there is no evidence of difficulty in breathing of the patient. So it is normal. So next one is we need to palpate for temperature, tenderness, and masses. So like what we do in the posterior. So using our palm, we hit first. So palpate, we will now palpate. So as you observe, the skin is intact. So there is a regular temperature. There is no signs of tenderness and masses I observe. So I don't also see any lesions and bulges to the chest of the client, so it is normal. So next one is we need to assess the respiratory excursion. So So we will now place our palm on the lower thorax. So with fingers along the ribs. So we will ask the client to take a deep breath. So, okay sir, can you take a deep breath? Inhale, exhale, inhale, and exhale. So, as we observe, there is a full symmetric excursion to the both lungs, and our thumbs separate 3 to 5 millimeters, so it is considered normal. So, next one is we need to palpate for vocal perimeter. So, like what we did in the posterior thorax, so we will now place our palm. So, hit it again. So, ask the client to repeat after us. So, sir, just repeat what will I say. So, blue moon. Is it okay, sir? So, place our palm at the apex of the lungs. So, say, sir, blue moon.
Blue moon.
So, okay, sir. So, another one.
Blue moon.
Okay, sir. So, and the other one.
Blue moon.
Okay, blue one. So, another one, sir.
Blue moon.
Okay. So, another, sir.
Blue moon.
One. Okay. So after that, we observe that there is a symmetric vocal peritus. So there is more loud sound in the apex than the base of the lungs of the patient. So which is a normal. So the next procedure is we need to percuss the anterior thorax. So like the percussion of the posterior thorax, so we will now place our fingers on the chest of the client and percuss it with another finger. So we will begin in the clavicle. So here. In the clavicular base. So So as we reach the diaphragm, we end the percussion. So since our client is male, so it is normal. So if the client is female, we need to expand the breast to percuss properly the anterior thorax of the patient. Since my patient is male, I don't do it, so there's no evidence of breast in the male, so it is normal. So we will now. So the resonates sound down to the sixth rib of the diaphragm. So there is a flat sound in heavy muscles and bones, and there is also sound in heart and liver. So there is also tympanic sound over the stomach, and we also observe symmetry of sounds between two sides of the lungs of the patient. So next procedure is we need to auscultate the trachea of the patient. So using our stethoscope, we need to auscultate the trachea, the upper left, to the upper left, to the upper right, so down to we observe, the bronchial breath sound is normal and there is no abnormal sounds like crackles and friction tube sound. So lastly, we need to auscultate the anterior thorax. So using again our stethoscope, we will start auscultation from apex of the lungs on both sides, downward to the base. So we will now start in the clavicle here. So inhale and exhale, sir. So down to the second intercostal space. So inhale and exhale, sir. The other side, inhale and exhale. Okay. To the fourth intercostal space, inhale and exhale. So the other side, inhale and exhale. So go down to the middle a bit more. Inhale and exhale. The other side, inhale and exhale. Okay. So inhale and exhale. Inhale and exhale. So as we reach the base of the lungs, we will ask the client to the right side of the client. So inhale and exhale, sir. So inhale and exhale, sir. Okay, sir, thank you. So as we observe, so the patient has normal breath sound. So that's all for implementation. For evaluation, so we need to evaluate if the physical assessment is within the normal range to determine if the nursing orders is need to change or completed. So for documentation, we will now report significant findings. So it is to provide accurate reflections of nursing assessment and to record information that can help to support proper treatment and of the patients. And always remember that everything is not documented is considered undone. So thank you po.